phototherapy treatment for eczema?
After we move beyond the foundation of maintaining a healthy skin barrier, and we've tried medications that are delivered through the skin as topical treatments, we then move often to another stage of treatment. So if your treatment creams are not enough, and you're suffering from eczema that has maybe spread to a body surface area that's hard to manage. We know that there's a burden of using topical treatments or creams and lotions over such an enormous surface area on a regular basis. Some people will benefit from using a light therapy to control the immune system in the skin. And this is a really interesting principle that so UV, so the same UV that comes from the sun, selected to be a very narrow band or a specific wavelength, is actually very effective at penetrating the skin and controlling or dampening the inflammation of skin or the immune system that's hyperactive in the skin. And so generally what that means is presenting to a phototherapy center where narrowband UV boxes exist, and you're essentially stepping into a light box for very short periods of time, but frequently, usually about 3 times a week. And I just want to point out that this is not the same as a tanning bed, and that we generally will, stress the fact that you do not want to use tanning beds to control your eczema, and that this is a light therapy that needs to be operated with a dermatologist or a physician because of the fact that it can lead to burning if it's not done in a controlled setting. And so what we generally think about with this is that you're usually using the light therapy for a period of months so that your eczema can continue to get better over time, and that you're putting this to sleep to maintain that response. It's often used in addition to creams. So often we say don't let go of the foundation and the medication by topical treatments, but you're adding this on top of your pyramid. The other thing to know about this is that it's not all that great at treating certain zones of the body that are not as easily exposed to the light, and that it's not necessarily going to be all that great at rescuing flares. So really angry, very, very hot and inflamed skin doesn't necessarily respond as well.